I'm Dr. Jeanelle de Gruchy and I'm Director of Public Health for Tameside. The rates of COVID in Tameside this week are over 700 per 100,000 of the population, which equates to approximately 1,500 new cases that we know about in the last 7 days. It's the highest it's ever been. The levels of vaccination mean that there aren't as many hospital admissions or deaths as there were before. But because the high level of cases, we are now starting to see people admitted to hospital, and sadly, some deaths are expected. This high level of cases and infection mean also that there's a strain being put on the NHS and on other public services. While we're keen to support businesses in welcoming people back to town centres and support you, our residents, in returning to the things that you love to do, we're urging you to take a cautious approach and continue to play your part in reducing transmission. Some of the key things you can continue to do to protect yourselves and others and help keep our local services and the NHS running include: please continue to wash your hands or use hand gel if you're out and about without access to soap and water. This is especially important before and after you get on a train, bus, or any other form of public transport, or if you're in contact with anyone who may be more vulnerable with a weaker immune system. And hand washing is also a really good way to protect against other common winter coughs and colds. Secondly, take a COVID lateral flow test, one of the rapid tests, twice a week, because you could be carrying the virus without having any symptoms and without knowing it, and you could be passing it on to others who are more vulnerable than yourself. You can order testing kits online or collect them from a local pharmacy, one of our local libraries, or one of our testing sites. And for more information on this, see www.tameside.gov.uk/rapid testing. Thirdly, and this is really important, please take the vaccine when you are offered it and make sure you get both doses. The vaccination reduces the chances of you getting severely ill with COVID. But you need to have both doses because that's really going to give you maximum protection against serious illness should you get COVID. Because remember, the vaccination will reduce your chance of getting COVID, but not 100%. So it's never too late to get the vaccination, and we're doing everything we can to make it easier for you. Our vaccine hubs are open to just drop in and get your jab, first or second dose, with no appointment or ID required. The locations, dates and times for these can be found at www.tameside.gov.uk/COVID vaccine. And we're especially keen to encourage 18 to 30-year-olds to get vaccinated. And this is one way that you can stay well enough to get to all the events and activities and holidays you're planning this summer. And it's also an important way that you can prevent other people falling ill with COVID who may not be protected from serious illness. Remember that some people are more vulnerable than others, so be considerate of the risks others are facing. That's getting yourself vaccinated. And then there's still a real benefit to wearing a face covering. Don't forget they protect others from you should you be the one with COVID. Wearing one on busy public transport, in shops and other places where it's difficult to maintain distance is a sensible way to reduce any spread, especially to those who may be more vulnerable. It's also important to wear a face covering where you're likely to come into contact with those who are at greater risk from COVID, for instance in hospitals or care homes. Remember, the virus spreads much less easily outside, so where possible, meet friends and loved ones outdoors rather than indoors. And try to give others space and distance when you're out and about to help them feel more comfortable and be safer, as they may be vulnerable to serious infection. When you do have to meet indoors, try to open the windows to let in fresh air And of course, wear face coverings as much as possible. I'd encourage you to keep working from home where possible. Remember, this is still about trying to reduce the amount of people you come in contact with as much as possible. Then finally, if you have symptoms of COVID, such as a fever, new continuous cough, or loss or change of taste or smell, then you must book a PCR test. Visit www.nhs.uk/coronavirus for more information about this. So the pandemic has been really hard for everyone. We all want to be able to return to seeing loved ones and doing the things we enjoy. Having barbecues with friends, going to the pub or a restaurant, going to the theatre, feeling some sense of things being normal again. But as our climbing rates of COVID show, COVID has not gone away. You or your family and friends could become severely unwell or pass on the virus to someone else who would. The freedom gifted to us from lifted restrictions comes with serious responsibility. We anticipate that there will be a rise in hospitalizations. This will be far lower than we've seen in previous waves, thanks really to the success of the vaccines currently in use, which are weakening the link between infection and severe illness and death. But we know that vaccines aren't 100% effective for everyone. So we all do still have a duty to do what we can to protect one another and to stop the transmission of COVID. Our health and public services are coming under increasing strain from the sheer number of infections and people having to therefore isolate. This is likely to get worse as we move into the winter season and the usual pressures that brings, even without COVID. We must all keep doing our part to make sure we are driving down COVID infections. Thanks to everyone for your continued support in doing everything you can to protect yourselves and each other and supporting your local community as we all take our next steps forward in managing the COVID pandemic.